For today's Heritage Highlight, I am joined by Renee Ziemer from the Mayo Clinic Archives. Hello, Renee.
Hello.
And we are coming to you from the boardroom in the historical suite on Plummer 3 here in Rochester. And Renee, before we start talking history, wouldn't you ever want to travel back in time to listen to some of the conversations that may have happened here?
It would be an honor to be able to listen into the conversations that occurred in this room.
It sure would. And you know, one of the things that the leaders may have talked about in those times was Mayo Clinic's medical record, how to improve it, how to store patient information. And that is what we're here to talk about today, because you brought a wonderful spread of archived documents that kind of show the evolution of how we started and where we are now. If you'd like to give us a brief overview.
Oh, I'd be happy to, Axel. When you think about innovation, we always think that it occurred today, but really Dr. Henry Plummer was the one that was very foresightful in his thinking about the medical record. William Worrell Mayo used a document similar to this. This happens to be Dr. William James Mayo's, and he would write about each patient. He'd write the date, their name, what was going on, you know, what was diagnosed, whether they needed surgery or what type of treatment outcome.
And it's just one book.
And it's just one book, and each physician had their own book.
Okay.
And so Dr. Charlie had his, Dr. Will had his, and as the practice grew and the new physicians came on board, they each had their own collections of books, but if they were out of town, obviously the patient was seen by somebody else, another physician, who didn't have that other physician's book. And the medical record evolved, but Dr. Plummer realized that we needed more than just written notes. And so we see the evolution from when Dr. Plummer came in 1901 to this particular page, which is June of 1906. And you can see how items have changed, where the name is included, the age, and it's already pre-printed in the book.
Pre-printed, exactly, yes.
And in addition, you see the anatomy of the body, and so they could distinguish where they were referring to in their notes, and so they could always refer back. 1907 record was in basically a file folder, a paper file folder, and it contained pertinent information, and there was a medical records department where when the patient was done with their appointments, the medical record went back to the medical records department. It continued and evolved, and so here we have, you know, a patient family history, we have a medical service record, we have, you know, basically a master sheet, and then as divisions and departments evolved, they needed special sheets, you know, to define their diagnoses. And so here we have a dental and oral surgery record, psychiatry and psychology general history, a neurologic record. And Dr. Plummer and Mabel Root were the ones that really you know, implemented the first 1907 medical record. And each patient was assigned a Mayo Clinic registration number. And we still do that today. That continues on. And then in the 70s, they actually issued cards, these
Actual plastic cards.
Yes.
Okay.
And very similar to a credit card today. You know, it's plastic, and it would have the patient's Mayo Clinic number, their name. Obviously, this is fictitious, but it would have you know, where they live and the date.
And then Renee, you mentioned was it the late 80s when there were first thoughts about maybe creating an electronic version of this record?
Right. We're always looking at being efficient and putting the needs of our patient first. And it was if a patient was seen by a general internal medicine physician and then referred to a specialist on the same day, you might have had a record over in the Baldwin building, but then it needed to get to the Mayo building or another building on campus. And so, yes, it was 1988 when really they started talking seriously about an electronic medical record. They started the conversations, and by the mid-1990s, they had implemented various parts of an electronic medical record. So the first rollout would have been like your laboratory results.
Sure.
And you could get those electronically. And then they just continued to add just to make sure that there was a seamless transition. And
it didn't happen overnight.
it did not.
But that kind of brings us to the present. We are now very familiar with electronic patient medical records, and that also kind of brings us to the future. What's ahead? And for that part of the discussion, I spoke with Dr. Bradley Leibovich. He is the medical director of the Center for Digital Health, and I spoke to him over Zoom.
I think a lot of people view digital as having taken stuff away, but if you think about the differentiating factors from our medical record being immediate access to patient information that moves around with the patient, digital systems allow us to do that even better, even faster, to a much greater degree. So if you think about, for example, when we went from having film images of patients to having completely digitized images of patients, and then you can have physicians, other care team members looking at critical portions of the patient's medical records simultaneously while collaborating, not just across our campuses, but across time zones and states with our various different facilities.
And of course, now we're seeing artificial intelligence, data analytics being involved in all of this. What does this mean for the next transformation of the medical record and patient care?
Well, one of the things that's paralleled the evolution of the way we look at data is the amount of data available. The ability to have artificial intelligence systems go through that data, provide some insights, and to summarize it for us will be absolutely revolutionary, and it will not take anything away from care team members in terms of their decision making, but support that in ways that we can't even imagine now. Think about, instead of rooting through the medical record, having the medical record summarized for you to help you answer the questions you need to answer about what to do for your patient. It can really increase our efficiency and allow us to focus more on our patients and actually less on computers and other things. It's not perfect. It will never be perfect, but I would argue that the control over patients' data and personal information is improved with digital systems over paper. Paper is much, much harder to control as it moves around than digital is.
Very well. Thanks so much for taking the time, Dr. Leibovich, and for your leadership in this area as well.
Thanks so much for your interest.
All right, Renee. Well, thanks so much again for sharing these fine things here and your expertise. We always appreciate it.
You're welcome. Thanks, Axel.
And thanks for watching.